Hey everyone, welcome back to the Holistic Rehab Room. Today we are going over total hip replacement. Total hip replacement, the definition, it's also known as total hip arthroplasty, and it is a surgery to replace worn or damaged hip joints. And what happens is the surgeon replaces the old joint with the artificial joint, which is known as a prosthesis. Etiology. So most hip replacements occur in people between the ages of 60 and 80. The most common reason is osteoarthritis. Then you have hip fracture, septic arthritis, ankylosing spondylitis, bone displacement, avascular necrosis. So if the circumflex artery is compromised due to a fracture, then that means that the blood supply is not getting to the head of the femur, which is actually an important part and it's necessary. So then you get avascular necrosis. So because the blood supply is not supplying the head of the humerus, that means that the tissue will start to die. Next, you have rheumatoid arthritis, and then you have also childhood hip disease. Surgery is recommended when you get pain that limits everyday activity, you get pain in your hip that continues at rest day and night, you get stiffness in the hip which limits the range of motion, or you get inadequate pain relief from anti-inflammatory drugs or medication, PT, or walking aids. The orthopedic eval includes the past medical history, physical exam, x-ray, or MRI. Implant components. Implants have four main components of femoral head and acetabular bearing surface materials. So the first one, we have metal on polyethylene, ceramic on polyethylene, ceramic on ceramic, and metal on metal, which is rarely used. I'll explain that in the next slide. And then you have ceramic on metal, which is uncommon. Complications. So metal on metal is a rare implant component, and they are more likely to release metal ions into the bloodstream, which may cause inflammation and bone erosion and other complications. The release of the metal ions from the components is known as metallosis. Next, we have anesthesia. So the risk is very small. It's approximately 1 in 100,000. Sometimes there is loosening of the joint, which causes pain and feeling that the joint is unstable, and this happens in approximately 10% of cases. Hip dislocation, so around 3% of cases, the hip joint can come out of socket. Most likely to happen in the first few months when the hip is healing. Wear and tear of the artificial socket, you have joint stiffening, so the soft tissues can harden around the implant, causing reduced mobility. It isn't usually painful and can be prevented with medication or radiation therapy, and you may have length discrepancy. Serious complications, so this is occurring in less than 100 cases. Blood clots, so small risk of developing a blood clot in the first few weeks after surgery, a DVT or a pulmonary embolism, and then there's a small risk of heart attack, stroke, or chest infection, and then there's also infection, so bacteria can enter the tissue around the hip joint. Advice and precautions is next. No bending at the hip more than 90 degrees, no crossing the operated leg across the midline of the body in sitting, lying, or standing, no twisting around in sitting, standing, or while reclined or in the lying position. You want to avoid lying on the operated side, as the person may cross their legs in a bent position. And avoid sitting on anything lower or bending down to reach past the knees. Maximum bend for a new hip would be 90 degrees. Thank you guys for watching this video, and I hope you learned something new today. Stay tuned for more videos, and I hope you like, share, and subscribe.